My name is Tina S. I'm from San Rafael, California, and this is my story. I was born with a chronic condition called Gaucher's disease. It's a very rare disease, and probably only 100 people in our country have it. I was diagnosed when I was 18 and sent away until I was 32 with no treatment. At 32, the FDA approved an enzyme replacement infusion that I have to be infused every 2 weeks under a clinic's care. And this will continue for the rest of my life. Because of the treatment, I was able to have children, which I was told before that I wouldn't be able to have children. So it was a very unique experience. And when I was first pregnant, I tried everything in my power. We took DNA testing to make sure that my son would not have Gaucher disease. And he wouldn't because my husband at the time did not carry the gene. So my son was born healthy. And when he was in the 7th grade, we discovered that he had type 1 diabetes. It's kind of ironic having another chronic condition in my family. So my story is more about my son now than myself, but he will have to make some same choices as I did. I can't work a full-time job because what employer is going to allow me to disappear every 2 weeks for a 3-hour infusion? So I work part-time and do freelance work. My son, who's 15 and a half, when he graduates college, he will no longer be insured by his father, and he will have to get health insurance on his own. And he better work for a big employer because this will limit his ability to go out and get the kind of work that he might want to do. Maybe he'll be an entrepreneur, maybe he'll want to do something on his own, but unless he works for a large employer, he won't have health insurance. So, I feel for him because...
How can President Obama help you?
President Obama, I'm really very proud to have voted for him because by offering a public option and giving people an affordable program to have health insurance, he will basically be and this is no exaggeration, he'll be saving my son's life and my own because we'll be able to afford the treatment that we need to keep us alive. So it's a very serious thing in my estimation. The way that it's worked so far, I've been lucky. Every 4 years, the employer would switch health insurance plans so I could not reach my $1 million cap and get new insurance and sort of wipe the slate clean. But that's just luck. I've been really lucky to this day. I don't think that people should have to rely on luck to get their health insurance. We have a right in this country for children to have a public education, and yet we don't have a child does not have a right to have public health. It doesn't make sense. If what's the point of having an education if you're not healthy?